Welcome everyone to Residence Medical's webinar today. We are in for a treat and a warm welcome from all of us here in California. You're in for a treat because while you're here, we're going to help you succeed in an interview setting with residency or fellowship program directors. What are you going to learn today? Interview successfully, professionally, with that poise, that confidence, and that credibility and that professionalism that is going to be necessary to really make that positive first impression and take it to the next step in your interview. So the strategies, the ideas, the tips and techniques that we're going to explore today, pick those up because we're going to be able to identify what's working, what isn't, but also give you an understanding of how it looks from the PD's view. Who's joining us today? We have experts. We have Dr. Raj, who's the PD emeritus and an expert in everything from the PD's experts. So we're going to gain that insight. Also, our residence medical tutor who knows all the ins and outs of what it's like to be in this situation as a candidate and how to get that interview. Now, for a more in-depth prep, check out our playbook, which we're announcing today, which is a superb opportunity for those that are just entering in and budgets may be a little bit tight, but this provides an in-depth opportunity to hone those interview skills. So please check out that new on-demand video series that we're launching today. It's exciting, it's cutting edge. But also, check out residencemedical.com, click on Teams, and if you want to set up a one-on-one complimentary consultation, you could do that with any of our team members at any point. So again, there's no better investment than the investment in ourselves. So what sets a great interview apart from the others? Let's hear from Dr. Raj as a PD. What are some of the key elements that you've seen maybe in the last 18, 24 months relative that are really some differentiators from the PD's perspective that really separate those quality interviews to the ones that don't quite cut it?
No, thank you. And welcome, everybody. Happy to be here and share some of my experience as a program director. I think what I'll talk about more is what not to do, because that usually is the things that kill an interview. One is making good eye contact, and I realize that I'm kind of not making particularly great eye contact because of the camera and image and things. But virtual interviews, even in-person interviews, it's important to stay focused on to whom you're speaking. There are some psychological things that say when a person is lying or making up an answer, they kind of look away, up and down, as if they're hunting for an answer. So basically staying focused on the interviewer, making good eye contact. And the other thing, a lot of mistakes that I see with applicants during the interview is they try to impress the program director or the interviewer with things that they've done. It is very rare that there's something in your CV or education that's really going to impress somebody. What they're really looking for is to make a personal connection with you, meaning they just want to know, I'm going to spend the next 3 to 7, 8 years, depending on what specialty you're choosing. They're trying to make a connection with you and see, can I teach this person? Is this someone that I would trust with the care of my family? So again, making that personal connection with them.
So that ability to connect not only with the patients, but also the fellow candidates and the residents that are there, as well as the staff. So it's that human relations, if we hear you correctly, that are really, really important. It's interesting when we get asked, tell us about your strengths, tell us about your weaknesses. How do we respond to that confidently without sounding boastful or awkward? And when Abraham Lincoln was asked that same question, tell us about your strengths, tell us about your weaknesses, Mr. Lincoln, when he was running for office, he responded to the strengths. He said, "Others have described me as dot dot dot." And think about that. It's humble, it's polite, it's professional, it's courteous. It's also third party evidence based. Others are describing. And the weakness question, that could be a trap for not getting hired. So the way Lincoln responded to that, he says the three things I intend to improve in the next 3 to 6 months are A, B, and C. And he used the word intent. So if we're hearing it correctly, it's that confidence, being natural, and thinking about that passion that really drives us. And that's so important because they'll be able to look up our academics. Is that right?
Right. I mean, if I could respond specifically to the strengths and weaknesses question, along the same lines about giving kind of support, personal things. If you were to respond, most people will say, "Oh, well, I'm a team player and I have attention to detail and I'm reliable," and they kind of leave it there. The best way to kind of respond to any question really is to give a few data pieces of information, right? I like cars because, or I like Ferraris and other high performance cars because they're fast, the attention to detail and engineering. But then go in to give kind of an example, and then close with the personal. So in the strengths response, you'd say, "Oh, I'm professional, reliable, and dependable," or something of that nature. And then, as Brian had said, you can say, "One of my preceptors during med school said this about me. I feel this is part of my character. This is a character trait of mine. It's something that drives me and something I believe strongly in." And then, with regard to the strengths question, you can follow up with how you will use those strengths to succeed in residency. Now, the weaknesses question, I think, at least in my experience, that question probably poses the most anxiety and concern for applicants because they feel they're there for the interview to impress the interviewer, and again, that's not really the goal. It's making the personal connection.
Exactly. Self awareness and accountability are really, really important character attributes, but also attitude and communication. Because we can't train attitude, and communication is so important. We can train you the technical aspects of it, but that's that human connection. Once you get in, that's going to be mission critical. So excellent points there. So, Dr. Iyer, what in your experience, what are some traps that we can avoid? You probably heard some stories that once you get into the interview and you start falling into those traps. How do you unwind that, and how better yet, how can we prevent that? What are some examples?
That's a great question. So the best way to deal with a trap and to avoid a trap is to have the right mindset from the beginning. So when people try to put you in trap situations, they're trying to take advantage of your insecurities, or if you feel that you don't deserve something, or you have this kind of imposter syndrome where you don't feel like you're worthy of it. And if they poke you and prod you, you can suddenly all the cards come crashing down and you start like hesitating and defending yourself.
Taking a look at that confidence and that attitude that you're describing, preparation for the interview is absolutely
Mhm.
everything. So, what are some other tips in terms of preparation to, including attitude, that mindset going in terms of demonstrating facts and making those relevant? Dr. Iyer, what would be some tips on that?
Well, I also have the same problem. When I get nervous, I talk fast as well. It's very natural to do, but you have to catch yourself when you do it. So, one thing is if you do notice you're talking too fast, you don't need to feel ashamed and feel, oh, I messed up. Like, man, I messed up this interview. None of that. Just consciously slow down. No one's going to call you out. I know we have this weird thought in our head. I especially do in the past when I talked faster. I was thinking if I slow down, they'll think I'm weird for suddenly slowing down. But it doesn't actually matter. They're not judging you based on like your changes that you make. They're evaluating you based on how you present yourself.
Sound tips. And, Eleanor Roosevelt once said, try something we fear every day. And when we do, it becomes more familiar. When it
Hmm.
becomes more familiar, it becomes a lot less scary. When it's a lot less scary, we tend to do it more. And when we do it more, it becomes natural. And that comes through with practice, doesn't it?
Hmm.
Practice is where we get to try stuff. So all the residence medical techniques that we have with our tutoring, our interview skills, those are all powerful. And our playbook has all those techniques, um, to get that confidence, start building, like you said, and don't try and boil the ocean and accomplish everything all at once. Those little steps that you mentioned, those 4 to 5 things at a time, narrow those down to some achievable advancements, and then you got a nice foundation to go with. Um, so, Dr. Raj, taking a look at preparation, what are some of the trends that we're seeing?
One thing that I have noticed, regardless of the pandemic, is how intensely some want to prep for interviews. And what I mean by that is, I did an interview prep on someone, oh God, it's probably within the last year, and they had scoured the internet for potential questions that they may be asked during the interview. And they had amassed something like 500 questions. There's just no way you can prepare 500 questions. Okay. The one mistake I do see with preparation with applicants is they'll get these questions off the internet and then they will work on them for weeks, days, months, however long, developing a perfect response that they either are writing down or typing out. Um, and I think it's good to think about the questions you might ask and how you might respond, but my advice is not to write down responses for a couple of reasons. One is the way that we write and the way that we speak is completely different.
So with our experts, with our counselors, there's an Asian proverb: if you want to know the road ahead, ask those coming back. So the expertise that we have in the room, making sure that we don't fly solo on this process, is so important. Have the support all the way from step one all the way to residency. So tap the wisdom that's out there. So some of the tips that you're providing are going to be life changing. One question that came up is, what questions can a candidate ask of the PD? So it doesn't have to be all one sided. One question that comes up to ask, that's worked well that we've heard, is asking the PD, okay, it's a year from now. You've brought me in as a candidate and we're all celebrating, and you're about to award me a nice gift certificate as the new resident candidate of the year. What did I do to earn this? And notice the word earn. And that, going back to what Dr. Raj started with, that personal and professional connection is going to be important. So, I'm sure a PD would appreciate somebody that's forward thinking and thinking about that Monet, Rembrandt, Van Gogh painting of what a good experience looks like, performed well, could help. But from each of you, what would be some questions that a candidate could ask in the interview that would be impactful and a differentiator?
The thing about these questions is that I wouldn't ever just have a list of memorized questions to go into to ask them about, because it's not really authentic if that's the case. The way you can come up with the best questions for a program director is to actually write out what kind of program you're looking for. What are your interests? What exactly do you want? And you want to ask them in the interview, at when it's time for you to ask questions, do you have this? Or, I'm really interested, let's just make an example, I'm really interested in dermatopathology. What kind of opportunities for dermatopathology exposure do I have in the hospital? Are there research opportunities where I can try and improve the field of dermatopathology? So the best way that I think to come up with questions is, it's very personal to you. What do you want? What do you see yourself doing in 10 years? And how can this program help you get there? Because it shows that the program director that you have standards for what you're looking for, and you're actually like choosing between programs instead of just taking whatever you can get.
Dr. Raj, your thoughts on that topic?
Karthik makes some outstanding points about looking into the program, thinking about what you want to do in the future and how the program can help you. Um, and also, Brian brings up a good point about making the interview a conversation and less of a interrogation, meaning they ask you a question, you respond, and then you sit there patiently waiting for the next question to respond. You want to make it a conversation because that, again, you're going to make the connection with them and show your interpersonal communication skills. Um, I think having some prepared questions to rely on if there is an uncomfortable silence during the interview, that you can bring out a question and get it rolling again. I think also, as Karthik said, you should kind of go with the flow of the interview and how things are going. For example, if they ask you what your strengths are, you can respond with a question of, "Well, what do you think the strengths of the program are?" And you can kind of have that interplay with them.
And making sure that our questions are not canned, they aren't uh, automatic, that they are very, very specific to the program are key ways to prepare. So I think we have time for maybe a little bit of a mock interview. And Dr. Karthik, if you'd be up for it, maybe we could do a little role play and provide some examples on demonstrating that poise, that confidence, and that response. Does that sound good?
Sounds good.
All right. So I'll play the role of the PD, and Dr. Iyer, tell us a little bit about yourself and describe your education.
Thank you for the question, Dr. Barry. My education started with, I would say, the first part of my education was my inspiration for becoming a doctor and specifically dermatology. I would go to India very often when I was a kid, and one particular moment really stood out to me that was a major inspiration for me. We were in this major bazaar full of people, and we had just bought some sweets because I love like Indian sweets. And we got into this auto rickshaw ready to go home, and this young boy around my age, I was around 8 or 9 years old at the time, something like that, comes up to me with a pen asking me for money, and his face is like full of marks. It looks like his ear is almost about to fall off. None of his parents are there. I don't see anyone around him, and he's asking me for change. And I'm about to give him something, and the driver of the taxi that's going to take me home, pulled me away and said, "Be careful, you might get infected by this and it could kill you." So I had like pulled away and I couldn't give him the money. And my mom is a physician, she's a cardiologist. And I asked her, "What does this kid have? What's going on with him?" And she said he probably has leprosy, or it's called Hansen's disease now. And I asked them, like, how does that happen? And she said it's a bacteria that can be treated with antibiotics. So this kid, all he needed was some antibiotics to cure him of this condition. And without these antibiotics and this kind of treatment, he's sitting on the street, slowly dying, trying to ask for little bits of coins so he can get some food. Who knows if his parents are even in sight? So that was really powerful to me. And I remembered that when I was going through college, high school, when I was going through college and deciding I wanted to go into medicine. So when I was in high school, I knew I wanted to be a doctor. So I took the SAT and ACT and scored well and applied to direct medical programs. So I didn't want to spend the 4 years in college a traditional route. So instead, I did a direct medical program of 2 years in college and straight 4 years in med school because I knew what I wanted and I knew what my dream was, and I wanted to achieve it in the most streamlined way I could. And while I was in medical school, I did a lot of dermatology related rotations. I even went back to India and did 3 months of dermatology during my summer break in India, and actually saw a lot of patients there and treat a lot of patients there and help them with their skin diseases and their various conditions. So that's my education and how I got to where I am.
It's interesting, Dr. Raj, if you could join me and audience, I think we're hearing very clearly Karthik's description of a defining moment in his life that played an important role on his intent, on his educational path, but also his passion, which drove him to his career. And remember, you were describing how important it was to the audience of making that personal and professional connection. And it's all about that character and that heart. So, some comments on Dr. Ayer's response there.
Yeah, I think the response was good. He kind of gave the background of how he got to where he is today. what his motivation is. Again, made it very personal. And I think it was perfectly fine. If I had one thing to say as a critique, it might have been maybe a little bit on the long side. And again, you've got a short window really to grab someone's attention. And again, when we're nervous, we tend to talk fast and we tend to talk a lot. So we need to give them an opportunity to kind of keep up with us.
That ties into the phrase economy of words. And somebody who was pretty academically okay, but had a great career, Albert Einstein once said, if we can't explain something clearly in 2 minutes or less, we probably don't understand it. And that's where the coaching comes in. Getting our intent, getting our passion across in the fewest words possible. So we're about ready to wrap it up on a good note. And again, please visit our playbook by Residence Medical, and that's the new streaming video course that gives you those specific added coaching elements for making that interview process smooth, confident, with poise, and professional. Give us a call. Visit Residence Medical and click on our team and set up a complimentary consultation. And reminder that we're here at every step of your path to United States residency. So it's been an honor and privilege to work with our guests. Let's show them some appreciation. Our entire Residence Medical team for providing this. And look for all of our gems on social media, which are regular, as well as our next webinar that will be coming up. So pay attention to that, and we look forward to partnering with you on your path to United States residency. Thank you very much, everyone.
Thank you.